Good afternoon, everyone. You're watching another 15-minute segment of 15 Minutes with Marcus. I'm sitting down with State Representative Bob Morgan, one of the top legal minds in the nation. He's an advocate for all types of issues, but particularly one of the things that we were having a conversation about was healthcare reform on all different levels. He's been a strong advocate of the people. He worked in the governor's office. He has his a legal practice that he's a part of, and he's done many things. But instead of hearing from me, I'd rather you hear from State Representative Bob Morgan himself. Bob, tell the people about yourself.
Thanks, Marcus. It's great to be here with you, and we know each other a long time, so it's really great. My background is in healthcare, like you said. I've done healthcare law and policy since I got out of law school. So I've been working in a lot of different capacities, everything from private practice, and I worked at a consulting firm where I went around the country and helped hospitals and health systems and doctors groups have better healthcare outcomes. Dealing with really rural communities where healthcare is really, really important. A lot of healthcare disparity out there. When you have economic disparity, you see a lot of healthcare deserts. And so really working through that, and then working in state government too, as you noted with Governor Quinn, helping to implement the Affordable Care Act in Illinois, now trying to move the needle as a legislator.
Right, definitely. I'm glad that you actually brought that up. The advocacy work that you do with healthcare, and you mentioned doing it in the rural areas. There seems to be, and it's not even about race, but when you talk about people from socioeconomically disenfranchised backgrounds, healthcare just isn't always the same. What could we do to even out the playing field when people do get sick and they do have issues?
Yeah, it's a great question. And there's a lot of reasons why we have this big disparity. There's something called the death gap in Chicago, right? So in death gap, the concept is by zip code, you can determine someone's life expectancy just based on where they live. Sometimes that has to do with healthcare, socioeconomic impact, education opportunities, job opportunities. That all leads to someone's life expectancy and their opportunities in life. And so there are a lot of things that we can do, but it's all interconnected. There's not just a single hospital that can be built that can just create a whole bunch of new opportunities, but it's all tied together, especially in Chicago where we have some of the best hospitals and health systems in the country, but you see people really struggle to get health care. We need to get to an emergency room. It's tough for a lot of people, particularly in the far west side and south side of Chicago.
Right. Oh, wow. So you say that, and it's a death gap. So if a person's neighborhood is not up to standards financially, if it's typically like a neighborhood with failing school districts, high levels of unemployment, then basically those people are expected to live a shorter life.
That's right. There's higher mortality there, and a lot of that is, again, all tied into healthcare. But it's not just a single cause. Really, it's education, it's healthcare, it's job opportunities, it's family makeup, community issues. It's all driven by these different issues, and they're all interconnected. So as a healthcare policy person, I focus on that. And what are the things we can do in Illinois to make that better for people, and really just stabilize these communities that need more opportunity in job and economic growth. But really, what are the health system implications there? What are we doing for obesity? What are we doing for the high incidence of asthma in areas where the air is not as clean to breathe?
Right.
And those are things that are all tied to healthcare that, as a legislator, I'm trying to focus on that.
So a lot of this is it some of this, would you say, is economic development? Because when I think of like certain areas, even like certain rural areas, again, some of this isn't about race. And I noticed there's like a lot of food deserts in certain communities as opposed to like a Whole Foods or even like a Jewel Oscar or Aldi even. So does that play like a big role?
Absolutely. I was just reading a story about this, actually, about not just food deserts in urban areas and high density urban areas, but in rural areas. We're finding a lot of struggles. Places where there's a lot of farming, they're actually having struggles because the farms that are there, they're growing the soy and the corn and the other food that they're shipping out and exporting around the world. They're not keeping it local. It's really an economic problem. So they have to sell it to large conglomerates and they ship it out of their towns. So these local stores in these farming communities don't have the opportunity for fresh fruit, fresh vegetables, things like that, and they're really struggling. So that's, again, it's all economic driven, but as a healthcare person, in my background, I try and focus on that The way we pay for insurance has a big impact on all that, the cost of insurance. The fact that people that are in their late 50s that don't qualify for Medicare, what are they doing with their health insurance if they're just going to wing it for a couple years because it's so expensive to get health care? What about mid-20s? Those individuals, they're just opting out.
Wait, what do you mean about the late 50s?
Yeah, so the people, you get sicker with age. And as you get older, when you hit 65, that's the magic Medicare number, right? So when you hit the number for Medicare eligibility, that's when everything starts to get covered. And even anybody who can't afford a supplemental insurance, they have insurance to cover what their healthcare needs are. But at their late 50s, early 60s, they're struggling. They start to really incur a lot more healthcare issues. They're still working, but they have a lot of healthcare issues. And so whether or not they pay for insurance, it's going to be the most expensive they've ever had to pay during that late 50s, early 60s range. And that's when they need it most. So all of that goes into insurance. And what's the insurance company going to charge? So they're the sickest, they're the most expensive, but they can't afford the expensive healthcare.
It's just too much. And like a lot of those numbers like that you put out there, I feel bad for not knowing this, but I actually didn't know, that itself.
Yeah, and I mean, it's all tied together, and it's one of the things that as a lawmaker, as a legislature, we make decisions all the time that have unintended impact.
Right.
We charge more for things in healthcare. The best, newest innovations and technologies that are saving people's lives are the most expensive. So if you don't have strong health insurance, the insurance company's not going to cover it. Worst case scenario, you don't even have insurance, and you're going to the emergency room. You're waiting until you're really, really, really sick.
Right.
And so that's economics, right? That's what we're putting money into in the state level for Medicaid. That's what we're doing with the federal level of Medicare. And when people talk about Medicare for all or Medicaid buy-in or selling health insurance across state lines, the whole point is the more people have quality and affordable health insurance, the better care they're going to take care of themselves. And that's really what we need to move towards.
With the Affordable Health Care Act, when that was rolled into place, because I'm hearing different things. When I ran the reentry program for people on parole and probation,
right.
We had like a big push. So what we would try to do is all the returning citizens, those are people on parole and probation, I would try to make sure that they all got enrolled into that program if they needed it. And ironically, just about all of them needed it.
Right.
If I had 1,000 people at that event, at least 800, they would roll out a paper. They couldn't enroll everyone. But with the Affordable Health Care Act, are we at a point where that is doing what it was designed to do, or is there still more work to be done with that?
Both. The biggest issue with the Affordable Care Act is we built a new system of health insurance coverage on top of the existing system.
Mm-hmm.
So on the bright side, there were hundreds of thousands of people in Illinois that didn't have health insurance before. And now because of the ACA, they do. That's great. That's a big step forward. Most of those were individuals that really needed the insurance and couldn't afford it. Now we're covering pre-existing conditions, and you can't be kicked off your health insurance because of a pre-existing condition.
Really?
Right? So you can't be denied health insurance coverage because you had some pre-existing condition. And that's a significant issue with regards to people that just have a lifelong health conditions.
Uh-huh.
So having that really makes a big dent. At the same time, it's getting more and more exclusive and more selective in terms of where physicians are providing coverage. So a lot of areas, you talk about food deserts or healthcare deserts.
Oh, really?
There's a lot of parts of the state of Illinois that don't have access to PPO. So people want to buy a PPO, they might not have an option because of their insurance carrier, because they can't afford it, or because the doctors and the hospitals aren't participating. So there's a lot of work that we need to do. And in fact, we've been sliding backwards, make it harder and harder for people to stay on health insurance. Obviously, the federal government, the Trump administration is really trying to attack that. It has, for the last 4 years, gone after the Affordable Care Act in every way they can. And that's going to continue. So you have to make sure that people have access to health insurance, because it's better for everybody. It is better for those that are uninsured because they have access to a doctor. It's better for the system because then you're not crashing in a really cataclysmic end-of-life situation where you're finally suffering from a heart attack or cancer or some really serious illness. And that's the first time you're going to see a doctor. That's the kind of issue when you have preventive health. That's the real deciding factor of how we can reduce healthcare costs.
And that's just one of the main ways. So the Affordable Health Care Act, it is doing what it was designed to do. It's just actually under attack. So certain people won't give it the opportunity to do what it's designed to do. It's almost like they don't care if you really think about it.
You know, that there are different lines of thought about what's the best way to fix healthcare in Illinois, in the U.S. And, you know, you can make an argument that the Affordable Care Act was imperfect from the start and needs to be fixed. And that's true.
Right.
You know, because it's been frozen in time since 2010, we haven't really made the changes that we needed to improve the system, to react to the ways that people are changing their health insurance needs. And so we're stuck in place, and that's never a good spot for any government program, let alone this.
Oh, wow.
It's such a big aspect of the economy.
Right. And like so many people are actually dependent on that. Is there a segment when it comes to imperfect access to healthcare? Is there any segment that you would say has it worse, or is it all on the same level?
Like, giving you an example, what do you think?
So an example, meaning homeless people would be one segment. And a lot of these different disenfranchised groups tie in together, but I'm talking like homelessness, or people who are coming out of long stints of incarceration, or just people who are below the poverty line.
Yeah, I mean, a significant percentage of people that are homeless are facing medical issues. So there's increasing percentages. I think 20-30% of homeless over the last couple of years increasingly are becoming homeless because they can't afford their health insurance costs.
Are you serious?
So they can't afford the prescription drugs, they can't afford their surgeries, can't afford their cancer drugs, and people are losing their homes because of that.
Over cancer drugs.
Over cancer drugs.
How and this is something, and I know, you know, I was kind of surprised. You know, I was in a really bad accident, and I still have to take the medications before the headaches. But I believe one of those prescriptions might have been $1,000,
right,
just for the headache, because it was the issue with the insurance. I went to purchase it myself, and the lady was basically like, "No, we have to work this out." Right. That's how I found out how expensive it was. And, you know, I would have like debilitating headaches. They were just awful. So I just really felt like I had to have this medicine just to have a decent quality of life. But something like cancer medication, I'm hearing rumors that certain medications are $20,000+. Is that true? Yeah,
it depends on the type of cancer, it depends on the medication, it depends on your insurance company. And the problem is that, you know, we're making advances in medicine, and increasingly it's just really expensive. So you have a real burden shift where the patients are the ones paying for the cost of the research, because insurance companies are just passing it off to their patients. Yeah. And physicians are struggling with the best medication possible, trying to help people save their lives, but they're making decisions regardless of the cost of the insurance. They're making decisions about what's available to them.
Right.
And if the insurance company isn't going to cover it, if somebody's offered the opportunity, I have somebody in my district, and I have a relatively affluent district in the north suburbs of Chicago.
Which suburb?
In Deerfield, Highland Park, Lake Forest, Lake Bluff area.
Okay.
So just southeast Lake County. And there was a woman's house I knocked on, you know, a nice middle class home, and she opened the door, we started talking, and she started crying. Her husband had just been diagnosed with cancer.
Oh, God.
And she had just lost her job. So they were uninsured. He was just diagnosed with cancer. Goes to the doctor. Doctor says, "I can provide these medications for you to save your husband's life." But the money that was going to cost them meant that they were going to lose their home. She ended up getting a new job that covered the health insurance costs. But they were right on the cusp of becoming homeless and not being able to afford their mortgage just to save her husband's life. Those are the kind of choices. Start dealing with prescription drugs. People are making every day. And we made a couple of big strides on that in the House of Representatives this year, capping the cost of insulin drugs.
Yeah. Well, that was you
great.
with
that.
that.
No, so it was Will Guzzardi. And Andy Minar in the Senate.
Yeah.
You know, so there's some amazing work that we're working on and things we're trying to do in the legislature. But there are a lot of people that need help. We have to do more.
Right. Wow. You know what? So we've just gotten to the end of the segment because it's only 15 minutes.
I know. Well, I'm going to come back. It's great.
Definitely. You know, at some point we're going to get like a panel discussion. Perfect. I know Kelly Flood is definitely interested in things. I would like to get a couple of you all together, especially like really, you know, people with a progressive type, you know, thought process with the information that you share with everyone today. You know, we just like look at the issues with healthcare, you know. It's truly sad. I don't even have the words for it, but I really appreciate what you're doing, and with the clear conscience, we're actually lucky to have somebody there, you know, like you, because I was actually referred, like, you need to have Bob Morgan on the show. this was definitely a well-respected friend who said that. But with your background, you're so passionate about everything that you do. You're the perfect example of what a elected official should be. And I'm really glad that we have you. And I hope you stick around for a long time.
Well, as long as the people of the 58th District have me. But no, I appreciate it a lot. I appreciate what you're doing. And this is a great opportunity for people to hear about a lot of different types of issues.
Mm-hmm.
And when people reach out to you too, let me know when people have different ideas, particularly in healthcare, things we can do.
Definitely. My focus, I dealt with healthcare like a little bit because coming from a criminal justice background, It was basically like, the needs of returning citizens, people coming out of long stints of incarceration are so stratified.
Yes.
However, healthcare alone, if you really look at it, people collectively are invulnerable to suffering, and we got to do something about it. And again, I'm glad that you were on the show. I would look forward to helping you in any way I can.
I'm going to take you up on that.
Everybody, if you can
Thanks,
see
everyone.
this, put your hands together for Bob Morgan, State Representative.
Marcus is the best.
Okay.
Thanks,
Thank you.
everybody. Appreciate it.
I appreciate you.
No.